If you're passionate about healthcare, about the legacy of excellence created by those who stand out for their exceptional contributions, and if you're excited about the possibilities of a greater and better future in health, welcome. This podcast is dedicated to individuals and organizations who brace the health tech horizons on a mission to improve outcomes, elevate the quality of life, and create new frontiers of innovation. Join us as we reimagine healthcare together. My name is Anna Maria Palucci, and our special guest today is Michael Archuleta. Top hospital and health system CIO, Michael's visionary and disruptive approach has earned him numerous accolades, including the prestigious HITEC Top 100 award. Also, he was featured among the esteemed 30 healthcare IT influencers to follow in 2023. With his extensive expertise and strong leadership skills, he has guided healthcare providers in adopting and integrating cutting-edge technologies. Under Michael Archuleta's visionary leadership, Mount San Rafael Hospital emerged as a trailblazer in leveraging advanced technology to elevate the patient and provider experience. The hospital attained HIMSS Analytics Stage Six recognition for its analytics electronic medical record adoption, a distinction achieved only by 30% of U.S. hospitals. Get ready for an inspiring conversation on the changing role of the CIO, trends in healthcare information systems, and driving positive change and innovation in healthcare.
So much for joining us today on our Tech Horizon podcast. Michael, I am extremely excited to get to sit down with you chat because, first of all, you're quite a persona. There's many accolades to your name as an influencer, as a health tech executive leader to follow, and someone who has shaped direction and strategic goals of healthcare organizations from an IT infrastructure standpoint. Well, thank you for coming. I'm excited to get to know you, and so is our audience.
It's an honor to be here. Really, it is. You're doing such phenomenal work as well, too. Really promoting the importance of technology, healthcare, innovation, which is much needed. I think this industry needs a massive disruption, and we're starting to really move forward with a lot of digital transformation. And it's exciting time. So I'm excited to really talk about this.
It really is. And I like to say we're at the inflection point. I feel like you've been noticing and in the midst of it for longer than I have and driving it, but it feels so tangible to me. And I really would love to get into the specifics of what your role looks like and the initiatives you've done. But before we get there, Michael, I'd like to chat with you a little bit about your journey, professional or personal. You have a very interesting background, both educational, professional, but maybe I can let you introduce yourself a little more so our audience gets to know you.
Absolutely. So again, just really humbled to be here. I started out very humble settings, which is always phenomenal. So my mother, she was a single mom and she had two kids. And I know she was extremely busy doing what she needed to do. And it was just amazing to see her determination, her grit, her work ethic. I'm so honored to learn from that woman on how important it is to have that GSD mentality. And that's what she had. And everyone asked me, what are you talking about, this GSD mentality? I'm like, my mom had this getting shit done mentality. There was really no room for any type of nonsense. This was always getting done, even with the small amount of resources that she had available. So that really engraved a lot into me. And you figure, I was an individual that was living in a very small, underserved community. I was the first individual in my family to go to college and graduate. And when I was growing up, we started living in the projects, and I had some rough bringings. And one of my biggest things though is that you have to develop that grit, that perseverance, that toughness to really even make it through those specific items. I remember even when I was in school, there was these individuals bullying, and that became a massive issue. I remember one day my mom said, "Hey, you know what? You need to stop that. That needs to end. You need to do something about it. You need to stand up for yourself on what's right." So I remember she took me to the local boxing gym, and that's what really gave me a lot of passion for that sport. So I started boxing when I was in fourth grade, and I had 50 amateur fights and made it up to the Golden Gloves area. I learned how to throw a punch, but I also learned respect. I learned accountability, and I learned just the importance of being a nice person to individuals as well. We started with nothing, and we're starting to have something now, which I think is huge. And just really being involved in a lot of different initiatives and really trying to pull up and push up the next generation of individuals, especially in underserved areas, which I really think at times is one of those issues that we don't really see much of. And then being a Latino in the technology industry, you see very little minority group in this overall industry itself. That really needs to change too. What really helped me is having that type of grit, that perseverance, and then of course having some good mentors in my life to really move forward. A lot of my friends got in trouble. I know some friends that are currently in prison, and I was able to escape that and get out. But my overall goal was I wanted to be someone. I did not want to be just another statistic out there. And I really wanted to make a big spark in regards to anything that I do. And that's why every time I discuss the no nonsense framework, I really contribute that to my mother's success because she developed that GSD mentality. And I always say that there's two different types of individuals that you're going to meet in life. You're going to meet the talkers, which talk, no actions come out of it. And then you're also going to meet the GSDers. And that's really the group that you want to basically be involved in moving forward because those are the individuals that are truly getting shit done and really making a overall impact in whatever they do. And that's been my overall goal with everything is being that GSDer, being a humble individual and really trying to pull up the next generation because I've seen even a lot of CIOs over my career path, there's been problems with them wanting to help an individual up to get to the next level. When I state that I'm here to help, mentor, and try to bring up the next generation, I'm an open resource and I'm available in doing that. And that is so important, I think, to create success. And it's been such a phenomenal journey with my overall career too. I went to a very small school at the time where there wasn't a lot of resources. There was no good resources for computers or technology. I remember the very first workstation that was given to a school was a Microsoft ME Millennial Edition operating system. And I was super excited. It's like, wow, man, this is awesome. During my time, this was starting to trickle a little bit more where the cool thing was trying to get on MSN chat and really try to chat it up. And we just had the nice little flip phones, but I saw the potential what this industry could really do. And I said, man, this is a very interesting industry that I really want to focus on moving forward. And I think it was a smart choice. And I think it's really critical. I try to also incorporate more STEM initiatives because I think we need to really bring that into anything that we do because we have to try to really help this next generation be as successful as possible and try to get some of these underserved individuals out of where they're at. In the end, education can really change a lot of things. I know we could talk about this all day, but it's been a very humbling experience. And again, I'm glad to be here and do what I do.
I would like to say that I'm proud of you. I'm sure it will sound condescending. So instead, what I'm going to do is I'm going to ask a question. You told us about why of the things that you've done and achieved, the why behind it, and the how in terms of the mentality, right? But what is the fuel that keeps you getting up every day and continuing the journey and re-engaging? So the reason I'm asking this question is because for anyone who tries to develop themselves and others around them and build something meaningful, the journey is not easy. And at times you feel discouraged. At times you may feel that you're not enough or that you may fail. And so you have to have that ability to build yourself up again, really have a clear vision of where you're going and restart every morning. Does that resonate with you? And if yes, then what is the thing that keeps you going ideologically?
I think we look in the mirror and we're always our biggest critics, but you have to be proud of who you are and where you come from. That's really critical. And I think one of the biggest fuels for myself has been my family, my children, my wife, to really say, hey, continue to move forward,
Yeah.
continue to move adelante, which is a Spanish word that means forward. And
Right.
I think that's such a critical component right there too, is that I look in the mirror and I say, maybe I'm not doing this right, or hey, I wish I was this or that. But you know what? That's just something that we have to get away from. Really think positive. Anything you spit out to the world itself, even on a negative standpoint, that could really manifest to who you are. And you really don't want that. Say you're the best. Say you can conquer. Because in the end, honestly, when you think about it, you could do anything that you put your mind to. And that is so important to create any good, successful outcomes for yourself. But the critical component here is collaborating with the proper individuals and always having some good, positive people around you. There was a saying, tell me who your friends are, and I'll tell you who you are. We have to put ourselves around successful individuals, mentors that have that same mind and thought process as yourself. Be proud of who you are,
Mhm.
accomplish your goals, speak positive to everything that you want to accomplish, and do them.
And I agree. And, what I'd like to ask you, because as I said, I'm an immigrant myself, I feel like my background has shaped the ways in which I relate to the world and what I bring to the community that I work in and the work that I do. Do you feel that being a Hispanic has influenced or has affected the way you interact with your professional community and the way you impact the field itself?
I think being a Hispanic, what it really impacts is understanding the overall underserved community. I think understanding what it takes when it comes to how do we improve on different initiatives. When I look at serving underserved and indigenous groups with technology, this requires a thoughtful and inclusive approach, which is really important. When I look at it, I say, as a Latino, how do I see access to technology? I got to really focus on that we need to really ensure equitable access for technology by providing strong infrastructure, such as internet connectivity, hardware devices. This can really be achieved through partnerships with local governments, nonprofits, and technology companies. I look at more of like culturally sensitive design. How do we develop technology solutions that are culturally sensitive and consider the unique needs, language, and customs of underserved and indigenous communities involved in community members in the design process to really ensure the overall appropriateness for what is needed. This includes providing multilingual user interfaces, contact transactions, and language support for customer service, which I think is really critical. When we look at some of the statistics when it comes to healthcare outcomes, we've seen that even the Hispanic community has been very underserved when it comes to healthcare needs. We've seen a higher mortality rate during the COVID-19 pandemic. We need to create solutions to improve outcomes and providing training and education programs to enhance digital literacy skills among community members is so important. This can really include teaching basic technology skills, basic programming skills, internet usage, and cybersecurity awareness to empower individuals to utilize technology effectively and efficiently. And this also gives them some opportunities. So, as an underserved individual and as a Latino, I remember one of the first times they had a cybersecurity boot camp in my area. And I was really excited. I didn't grasp what that meant. If I didn't have that type of exposure either, I probably wouldn't have had a passion towards technology or security. And as a CIO, we have to continue to build asynchronous tools that benefit the patients both inside and outside of our organization. And that's why looking at more mobile technology initiatives, how do we create better technologies for these individuals to utilize mobile technology to reach remote and underserved areas where access to traditional infrastructure may be limited? By incorporating mobile apps, text messaging services, and telemedicine platforms, This can really help deliver essential services and healthcare information directly to individuals' devices. When we spun up a lot of telehealth clinics, telehealth was one of the biggest things during the overall pandemic. That was such a lifesaver for a lot of these individuals. And then looking at more of your collaborative care models, how do you validate that information? Collaborative care models that connect the healthcare providers, community health workers, and remote specialists to really deliver healthcare services and consultations to underserved communities. This can include telehealth platforms, remote monitoring devices, and virtual consultations. Remote monitoring, such a new innovation of keeping the patient home, keeping the patient more in an environment that he or she feels more comfortable in, but having that ability to still validate and monitor to create better outcomes. Because at the end of the day, when I look at it and I'm putting on my healthcare CIO hat, is that each individual, if you work in healthcare, I don't care what your position is, you have a new CEO, and your new CEO is the patient.
Yeah.
The bottom line in regards to anything that we do,
Yeah.
because the patient is really the individual that determines, do I want to have care there? A lot more patients are taking more control of their overall care initiatives. And it's extremely critical for these individuals to say, hey, is this organization truly building the asynchronous tools that are going to benefit me when I'm there and when I leave the organization itself? And then one more item to add to that discussion of underserved is how, as a state, do we look at creating better outcomes? And that's by data collection and analysis. It's really important that we leverage technology for data collection and analysis to understand the specific healthcare needs and challenges faced by underserved and indigenous communities. This data can really help drive evidence-based decision making and targeted interventions.
You've touched on so many points that have 10 questions related to them. So I'm going to try to organize my thoughts here. First of all, congratulations. The governor of Colorado appointed you as the commissioner on the Colorado eHealth Commission, which means you get to do all these wonderful things for marginalized communities, but also for the larger Colorado community. So that's all impressive. And I wish you the very best of luck to you and the team there. In addition to that, I heard you say that healthcare organizations are digital companies that deliver healthcare services. So I think that goes in line with what you've been just talking about in terms of the different technology that need to be adopted and how those translate into outcomes and how healthcare organizations are the means and the vehicle for that happening. And so my next question, and I feel like you have something to say, so
This is what I always say is, and I mean, you brought that up. We're living in the digital age of healthcare, and that is so important. The thing is, I did a discussion with Columbia University, and we were talking about the brick and mortar theology of healthcare. Healthcare has always been built on, right? Now I'm putting back the CIO for the healthcare organization's hat back on. How do we improve on better initiatives? We have to change that overall mentality.
yeah.
Hospitals, clinics, digital companies that deliver healthcare services. I always say this, and everyone laughs about it, but it's a truthful statement. Ladies and gentlemen, it is about time that the Flintstones, meaning healthcare, meet the Jetsons, meaning
Yeah.
disruptors. And that's so important, especially when we look at how this overall industry has evolved. When the Affordable Care Act was established by President Obama, started mandating a lot of these specific organizations to implement an electronic medical record system. But a lot of these organizations weren't ready because they've never looked at technology as a good core component to their overall organizational strategy. Culturally, we've had that brick and mortar theology that healthcare has always been built on. And we've always considered IT, technology investments, digital transformation as well, cost centers, right? Versus strategic revenue contributors. That is such a critical component. And one of my goals in IT was moving away from being a ticket taker, being more of a value maker to the organization itself. And that's critical. When we look at this industry as a whole, we've seen how the evolution of the healthcare CIO has been from more that tech manager to just focused on being an advisor role to now really being that CIO 3.0. that driver's role, being a project advisor, a venture capitalist, a customer service individual that focuses on strong initiatives there, an innovator, economist, a disruptor. I think that's really a big difference on what's happened. And I myself as a disruptive CIO, I'm very passionate about using better ways of using technology to create better initiatives for patients. There's so many amazing things happening with, for example, we hear the buzzword chat GPT. We hear generative AI initiatives. We see how this is really revolutionizing different areas in healthcare, really bringing advancements in diagnosis, treatment, and patient care. We're continuing to revolutionize the different processes which help streamline the diagnostic workflow. Generative AI algorithms are just so important when it comes to medical imaging analysis in doing the detection of diseases and abnormalities for radiology images, such as X-ray, MRI, CT. It's critical that really reposition where technology is within the healthcare organization, because this isn't a business makeover, but a true business revolution that needs to be incorporated culturally if we want to continue to move forward. The healthcare industry in the United States, it's getting more complex.
AI is a great tool. We all agree that we need it. We all agree that it's not going anywhere. It's here to stay, and it will change and improve and really enhance outcomes. However, we have a number of difficulties. Electronic health records, CRMs, are not currently built in a way that is conducive to gathering the information that we need. That's one question. Has that been an issue for you? And if it has, how do you go around the challenges in terms of missing data, inconsistencies in documentation by healthcare providers, missing fields, or any other data that's not there, it has to be inferred, it can be inferred incorrectly? And how do you prepare in order to use AI for better insights?
Wow, that's a lot there, but I love it. Promoting data accuracy in healthcare is really crucial for ensuring patient safety and effective decision making. So when you look at data accuracy, you have to focus on standardization, data collection processes and terminologies across the healthcare system to really ensure consistency, accuracy, and data capture. You're going to be successful in what you do. And I also think by incorporating training and education to the healthcare professionals that work on data entry and documentation practices to minimize errors and promote accurate data recording, because we are as good as the data that we put in. We have to implement mechanisms to really validate and verify data for accuracy, such as automated checks, data audits, and regular data quality assessments, which is so important. And then, of course, looking at some of the technology solutions. How are we personally as an organization leveraging the technology solutions such as the electronic medical record system, clinical decision support systems that include built-in data validation features? This can include regular data reviews, data cleansing, and error correction procedures. We have to look at developing a robust data governance policy and procedure to ensure data accuracy, integrity, and accountability. I love encouraging reporting and feedback. I love encouraging our organization to report any disparities or errors they identify and provide a feedback loop to address and resolve these issues promptly. That's where the GSD comes into play. Looking at that feedback, the overall problem that we're seeing, resolving it in a quick manner. And then looking at how do we continuously improve our overall focus, foster a culture of continuous improvement by regularly reviewing data accuracy metrics, identifying areas of improvement, and implementing corrective actions. If you implement these strategies, healthcare organizations can really enhance their overall data accuracy, which basically leads to more reliable and informed decision making.
A great answer. Thank you so much. Very comprehensive, all through thought out. However, I feel like there are challenges with implementing all of those different strategies. So, one would be that healthcare providers will document, and the way they document, it will take a long time before the documentation practice changes according to the needs of the system for two reasons. One, because we as healthcare providers want to document as close to reality as we perceive it as possible in the language that feels most natural to us so that we can capture the incident or the discussion correctly. And second, we are rushed. So a combination of the two makes for notations that are not adequate or ideal for structuring data and so on. What are your thoughts?
So this is what I think too, is that there's a lot of challenges in regards to this. We know that. Okay. So as you stated, data entry errors, that is such a major issue. And then looking at some interoperability issues is also a problem. I think the healthcare systems, again, use so many different EHR systems, and there's never been a strong standard way of communication because interoperability has been one of those specific buzzwords that we continuously hear there and there. But the thing is, are you truly interoperable? Is the system truly interoperable? We've seen the overall FHIR standard coming out of the HL7. So the Fast Healthcare Interoperability resource has been one of the most prominent specific standard languages to really come out of that specific group, especially looking at connecting APIs into the overall FHIR standard and sharing information more effectively, efficiently is really important to really see how do we improve on these specific initiatives? How do we allow this information to basically share? And then looking at data integrity and standardization. We have to standardize. This overall industry has so many different processes in place. It's unreal. Cybersecurity as well is that data security and privacy, because protecting patient data from breaches and unauthorized access is a significant concern. And striking a balance between data security measures and ensuring appropriate access for healthcare providers can really be complex at times.
Yeah.
So in some cases, extreme security measures may be inadvertently hinder data accuracy due to restricted access, which becomes an actual problem. And I think patient engagement and data accuracy is so critical because by engaging patients in their own care and encouraging them to actively participate in data reporting can really enhance data accuracy. There is some challenges that arise when patients are fully unaware of their role in data accuracy or lack of the necessary tools. Addressing these challenges, it requires a multifaceted approach from the implementation of advanced technologies to standardization efforts, to staff education, to training, to improve data exchange and interoperability and patient engagement strategies.
Yeah, and those are all fantastic points. And so, if I were to ask you, would you be able to give me three or four shining stars in terms of technologies that you've used or you've seen or you've heard of that are effective in one, automation of the process that will result in data accuracy, and two, in ambient transcription of conversations with patients. Did that happen? Have you seen it in place? And would that help?
Yeah, absolutely. So I could definitely give you some examples. So Ada Health is an AI powered chatbot that really helps users access their symptoms. It provides personalized health information and guides them in seeking medical attention, which is really critical. And then there's also Wobot. So Wobot is also a chatbot. It's really designed to really provide mental health support and therapy to individuals, really offering more evidence-based techniques and more personalized recommendations for them. And then, of course, there's the famous IBM Watson Health. The thing is, IBM Watson uses LP to really analyze medical literature. It looks at research papers. It looks at patient records to assist in clinical decision making and really provides more enhanced, accurate, evidence-based treatment recommendations, which is so important. And then we're seeing what Google is doing. You've heard of Google's DeepMind Health, right?
Yes.
So their overall DeepMind Health has really utilized that NLP to really extract valuable information from medical documents and improve patient cares by identifying potential health risks and treatment options. These specific different groups are creating some amazing initiatives to create better outcomes for when you're looking at more of that natural language. How are we incorporating? How are we obtaining all of this specific data to create better outcomes, better ways of compressing all this information, putting IBM Watson through medical school. obtaining all this medical literature because you figure there's new literature coming out every single day. And how do we come out with and compress that to build the best, more evidence based care initiative to create more enhancements and improvements to overall personalized treatment plans? And again, one important thing here is how do we get this into an area where we're getting real time data? And I think that's really important too, is having the capabilities of doing. And if we could obtain this real time data, we can utilize this technology, we could create a lot more automation initiatives because in the healthcare industry itself, we're doing a lot more with less. So
Mm.
automation is key. We're seeing what's happening with these poor providers. There's such a huge burnout rate for these individuals. And I really think automation, we can utilize tools like Chat GPT and generative AI, which contributes to automation in healthcare by streamlining repetitive tasks and workflows and freeing up healthcare professionals to focus more on patient care. Because in the end, let a doctor be a doctor. Move that physician away from the overall screen. Doctors have to be doctors again, have more focus towards their overall patient. ChatGPT is doing some phenomenal work. Generative AI technologies are really doing some huge work in this overall industry, and it's coming.
Very interesting. And so, as a CIO, I'm assuming you work with different vendors doing the work that needs to be done and integration, automation, creating different tools, and also incorporating AI, local use cases, or whether it's generative. So, my question is, how do you decide what are the parameters that you use to judge the vendors that you work with to make sure that they're going to be delivering on this new technology that is not yet proven in the sense that we don't have a clear path forward. We're all discovering it all at once. So how do you approach that?
So that's funny because the way I look at that is that there's a difference with vendors and business partners. Okay. So in this organization, I've had multiple vendors that I fired completely because in the end, these individuals are wanting to, they promise me the world. There's no support in regards to it. They're selling me a product. And then a year later, they're wanting me to renew their overall contract. It's just a basic vendor to me there, Anna Marie. That becomes an actual part of the issue. I'm looking for strong business partners. I'm looking for business partners that have the same mentality as I do. And that mentality is my success is your success and your success is ours. And it's very simple too, is if we can have that good focus towards success, that understanding of healthcare, the overall roadmap of where we're going, we're seeing this massive digital transformational initiative. And I've seen a lot of these good business partners as well is hiring ex-CIOs from healthcare organizations to come into their organization and also just understand that CIO, that colleague to colleague interaction. Because at times is if you don't have that specific experience or you've done what I'm doing, but you're trying to sell me a product, there's no successful outcomes incorporate that strong partnership, business partners. I don't deal with vendors. I
Mm.
hire vendors. I deal with business partners because in the end, if it wasn't for very strong, collaborative, just innovative, disruptive business partners that I've been able to establish within my overall professional career, I wouldn't be in the area I'm at now. So it just takes a complete village and a good, strong collaboration to put yourself into individuals that have that same mentality, organizations that have that same overall mission and vision of what you're trying to accomplish.
Great. And so to wrap it up a little bit in terms of what I've heard you say is your main focus, it is obviously patient engagement. That's through the creation of an infrastructure that supports change and adoption of the appropriate technologies. And also everything that has to do with data accuracy and data security and confidentiality. So those are the key pillars. But in addition to that, you also mentioned telehealth and decentralized access to care. And remote working for employees of the hospital that don't necessarily need to be within the premises of the hospital.
And you know what? You bring up a good point there too, is look at the remote workforce that we had to establish during COVID-19. Look, I know a lot of organizations that struggled in sending their people home because the issue is they did not build a strong foundational technology driven bone within their organization, which created a lot of problems. They had issues spinning up specific telehealth. They had issues sharing information. They had issues sending people home effectively, efficiently, and secure. And you figure that's not us because you have to ask yourself, is your home in order? And that's really critical too. And our home was in order because we built that strong foundational point. We focused on a lot of virtualization, focused on a lot about cloud-based initiatives, next generation technology, huge enhancements towards cybersecurity focus. 99% of our environment is completely virtualized. So on the server standpoint of things, 90% virtualized utilizing virtual desktop infrastructure through VMware. We use Horizon for the environment itself. We also use two-factor authentication and a single sign-on option within Privata. So this basically allows our end users to tap and go. They have a specific badge. The badge allows them to tap access. There's dual authentication involved in obtaining access. But this virtual desktop persona allows them to go from room to room, that profile following them. So then, of course, if you go home, you're accessing all your information just as if you were in your specific office itself in a very secure manner. We're also utilizing a hyperconverged infrastructure environment within our overall data center. We utilize that through Nutanix. That has really just been a game changer of what we've basically done as an organization completely, which has been huge. But again, I had focused on building a strong foundational point that allowed us to be successful in those specific areas. Because in order to even look at this next generation, look at artificial intelligence, look at data depositories, look at this new technology coming into place.
Very interesting. And so I want to ask you a couple more questions. I think we're getting closer to the end, but I'd like to still touch on the interoperability piece, which is specifically related to the electronic health records. Are you comfortable sharing which one you're using? And if you chose it on purpose, why you chose it? Did you have any considerations related to flexibility and access and interconnectivity to other platforms?
So with the electronic medical record system, as I stated in our prior conversation too, there's been so many multiple flavors of EHRs. And as an organization, we've utilized groups from Meditech to MedHost to Athena Health that really incorporated us to try to move forward. I think too, though, a lot of these EHR, when the Affordable Care Act came out and when a lot of these facilities had to implement an EHR or they were going to be penalized, really made them just jump on board quickly and at times ineffectively, which created some problems with anything that we do. And when you look at the overall evolution of the EHR, you've seen that a lot of it has been focused on technical engineers building the overall platform versus clinicians getting involved. It wasn't really clinically focused when it comes to interoperability. These EHRs finally wanting to play nice with third party groups because these EHRs have been very siloed with their proprietary software. And that becomes a massive problem too. I'm a disruptor.
Yeah.
I love disruption. I work with so many startups right now too. It's just phenomenal. And a lot of these vendors, even like Epic, Cerner, they never wanted to play with these open source third-party applications, which create a hindrance, a problem with making their product more effective and efficient, better ways of collaborating. The adoption of HIE standards, the health information exchange programs has really been critical. Looking at how the new standards coming out of the HL7 group, utilizing the fast healthcare interoperability resource has really been important as well. We have to continue to look at investing in those robust integration solutions. I think too, as a healthcare organization, we really have invested in integration solutions that have really enabled that seamless data flow among disparate systems. This can really involve the use of middleware, the APIs, the application programming interfaces, and integration engines, being involved in a lot of initiatives with our electronic medical record system, boards of our advisory groups of improvements of different regulations of betas, utilizing the actual technology, being the first testers to use it, continuing to support regulatory efforts, policies. Complying with these regulations can really facilitate data exchange and interoperability. You have to really be involved in that, really being, again, as a CIO 3.0, you're an economist, you're an innovator, you're focused on being a political visionary, involved on what's happening on the Hill and trying to understand some of these regulatory initiatives is so important. Improving interoperability requires really involving healthcare organization, technology business partners, regulatory bodies, and industry stakeholders.
Thank you. You pretty much gave us all an idea of where the priorities lay and what we need to do next in order to move forward, especially at the CIO sort of level in the information technology world. So I would like to take this opportunity again to wish you the very best in the work that you do at the Mount Rafael Hospital and clinics, but also in your career. And so I will finalize with a question, which is, what is the near future for Michael? What would you like to see happen next? And who would be the individuals and companies that you would like to approach you for conversations? And if they do, is LinkedIn the best way to reach out, or do you have another preferred method?
Absolutely. So in the end, I always say that I'm an entrepreneur, I'm an innovator, I'm a disruptor. I'm always open for ideas, better efficient ways of creating more automation. It's better ways of keeping organizations secure and safe, better ways of sharing information. I'm an open door. I'm looking for those next generation business partners that have that same mentality. My success is your success and your success is ours. Those are the type of individuals that I'm looking for. And again, Anna Marie, this was a phenomenal thing. You're doing so much, so many just amazing work out there. I'm always continuously following you on LinkedIn. You're an innovator, you're a disruptor, and you're a GSDer too. So
Yes, I am.
welcome to the family from that. And honored to be here with such a phenomenal discussion with you. You can find me on LinkedIn. I'm very active on LinkedIn.
Yes, I follow you as well. And I'm very impressed with your achievements. And I just want to say one final thing. I really
Please.
look forward to staying in touch. I look forward to supporting your cause and the work that you do. It's very exciting. And I think in Canada, we have the same visions, the same challenges, maybe slightly different, but it's exciting to see someone, and I identify with you as an immigrant as well, someone who truly has taken every opportunity given and has pushed things forward on a professional and personal level and has achieved great things. And congratulations. Very impressed. We wish you the best. And we look forward for the next episode together on Health Tech Horizon podcast.
Excellent. Thank you very much. I appreciate that.
Thank you. All the best.